After your operation, the time it takes for each operation is different, as this depends on your condition and the type of operation you require. Every patient's recovery rate is different. This depends on your general health and any pre-existing conditions you may have. Critical Care Unit. Following your operation, you will remain on the recovery area within the theatre for a while. Then you will be transferred to the critical care area. When you wake up in critical care, there will be a tube in your mouth to help you breathe. As this goes through your voice box, it is impossible to talk or indeed make any sound. Our nurses are very used to this situation and are very good at communicating with patients who cannot speak. This breathing tube does not make you gag, retch or vomit, as you imagine it might, because during the operation your throat has come accustomed to the idea of a tube being in place. You will be attached to a breathing machine for a number of hours after the operation, depending upon the surgery and your condition following the surgery. If you are on the breathing machine for any significant length of time, you will receive drugs which will keep you asleep or at least comfortable. Once you are awake and able to breathe deeply on your own, the tube will be removed and replaced with an oxygen mask over your mouth and nose. It is important to take deep breaths and cough at regular intervals, as this will help to expand your lungs and prevent infection. You will also have additional drips in your neck or groins. Whilst this may sound unpleasant, it is in fact painless. You also have a urinary catheter draining urine from your bladder. The mainstay of pain relief for the first 24 hours after your operation is morphine. This will be administered either by the nursing staff or by a device which you are able to control yourself. This choice can be discussed with the anaesthetist before the operation. As soon as you are able, we will give you painkillers by mouth in tablet form. It is important that if you are not comfortable, you should tell the staff looking after you. Apart from a simple desire for our patients to be comfortable, we know that you also breathe better if you are not in pain, so do not hesitate to let the staff know if you're uncomfortable. Patients remain in the critical care unit as long as it is necessary until the doctors caring for you are confident that you can be safely transferred back to the ward. The majority of our patients stay 1 day or less and are usually transferred back to the ward the day after their operation. Breathing exercises. Physiotherapy staff will visit you on the ward after your surgery to teach you some breathing exercises. They are designed to increase your breathing function and also to make it easier to clear any secretions from your lungs. It's a good idea to start practicing these exercises before you're admitted to hospital. After your operation, you will be asked to do the exercises 1 to 2 times per hour. 1. Sit in a comfortable upright position and take a deep breath in through your nose. 2. Sigh the air out through your mouth. This is the deep breath. 3. To huff. Imagine you're steaming up a glass, a short, sharp out breath. 3 to 4 deep breaths. 2 to 3 normal breaths. 3 to 4 deep breaths. 2 to 3 normal breaths. 2 to 3 huffs. And cough. If your cough is clear, then stop here. If your cough is rattly, then repeat the whole cycle again. It's very important to drink plenty of water throughout the day, which will help you loosen any secretions. Irregular heart rate, cardiac arrhythmia. On occasion, some patients may experience a heart rhythm disturbance or palpitations following surgery. This may happen in the first few days after your surgery. If you do experience these symptoms, it is most important that you inform a member of the nursing or medical team. Infusions and catheters. Whilst you are asleep, you will have drips put into your neck, arms, and possibly into your groin. These will allow you to have any drugs or fluids required, and also help the staff to closely monitor your heart. You will also have a small tube inserted into your bladder, a catheter, which will allow urine to drain freely, and staff can measure exactly how much urine you are passing. This will be removed in the intensive care unit or when you're back on the ward. Chest drains. Following surgery, you will have 2 or 3 chest drains. These are tubes leading from your chest to a bottle, which will drain fluid or air from around your heart and lungs. These drains will be removed as soon as the fluid has stopped draining and they are no longer required. Prior to the removal of your drains, you will be given some pain control. Once removed, you may have a stitch at each drain site, which will be removed after 7 to 10 days. If you have been discharged home before this, we will arrange for the district nurse to do this. Pain relief. Effective pain relief is important following your surgery for your comfort and recovery. One of the main priorities of your nurse and anaesthetist is to reduce your pain as much as possible. In the first 24 hours following your surgery, you will usually be given pain relief through the drips you have in place, or through a device in your arm. As soon as possible, we will give you your pain relief in the form of tablets. It is very important that you let the staff attending to you know if you are experiencing pain, as they will review your pain relief medication. Pacing wires. Depending upon the type of surgery you have had, you may have two small wires coming out of the skin on your chest. These are a precautionary measure. They are there in case your heart beats too slowly. These wires can be attached to a pacing box, which will give you the extra beats your heart needs. These wires will be removed before you leave hospital. If, after the operation, you feel that your heart is racing or misses a beat, then please inform your ward nurse or doctor, as this can sometimes occur after heart surgery. Surgical clips. During the bypass operation, small metal surgical clips are used to seal the cut ends of blood vessels during the harvesting or removal of veins. These surgical clips are designed to remain in the body and are chemically inert. They do not oxidize in the body and do not cause problems. On occasion, they can migrate or move through the skin, but this indicates that they are no longer required by the body to stop bleeding, and this process is harmless. Do not become alarmed or concerned if this happens to you. Getting up and about following your operation. Following your operation, you will need to get up and about as soon as possible. The earlier you begin to get moving, the better. It's important to get moving early, as this helps the heart and lungs to recover and may prevent constipation, stiffness and pressure ulcers or bed sores. You will be assessed and advised to reduce your risk of a slip, trip or fall. Each day as you recover following your operation, you should aim to be more active. At first, nurses on the ward will help you and teach you how to move without putting too much pressure on your arms. It's important that you do not put pressure on your arms until your breastbone, which has been open for the surgery, has completely healed. It usually takes about 3 months for it to heal completely. It is important that you do not push through your hands when you stand up. You will need to shuffle your bottom towards the edge of the chair, take your feet back towards the chair and keep your feet hip distance apart. Put your hands together and stand up. The following information can be used as a guide to the first few days when you are back on the ward. It is important to remember, however, that everyone is assessed individually. You will be given individual advice by nursing and physiotherapy staff. On the first or second day, the nursing staff may ask you to sit out of bed and walk a short distance around the bed. On subsequent days, you'll be given a target to which you should walk. Most wards have coloured hearts on the walls, which you can use as a guide to how far to walk. Each day, you should aim to reach the next heart. Day 2 following surgery, walk 3 times to the red heart. Do this twice today. Day 3 following surgery, walk 5 times to the yellow heart. Do this twice today. Day 4 following surgery, walk 8 times to the green heart. Do this twice today. Once you've started walking on your own, you should aim to take a short walk every hour or 2. By the time you go home, you should be walking freely around the ward, and the nurse or physiotherapy staff will ensure you can comfortably climb 1 flight of stairs. If you have any problems with mobility, the physiotherapy staff will assess your needs and offer guidance and support. Rest and sleep are also an important part of your recovery and are just as important as exercise. Nurses will advise you on achieving a healthy balance between getting enough exercise and enough rest following your operation. You may be given support stockings to wear following your operation to help your circulation and blood flow. In addition to this, a small injection of anticoagulant may be given to help the blood flow freely and prevent clots from forming. It is not unusual for you to feel aches and pains across your shoulders, neck and in your chest. You will be advised by the nursing staff when to remove your stockings. Personal hygiene. Initially, the nurses will help you with washing and changing at the bedside until you're able to go to the bathroom for a shower. If you manage to shower yourself before your operation, then by the time you leave us, you should be able to do so again. Wounds. Most people have a wound down the centre of their chest, a sternotomy, and also from where the grafts, if any, have been taken, such as your arms or legs. These may cause you discomfort or muscular aches in other areas such as your arm and your shoulder. Eating and drinking. Initially your appetite may be poor and your sense of taste may be altered, but the nurses will encourage you to try and eat and drink. After your surgery, prior to your operation, you may have been advised about losing weight. In order for your body to recover properly and your wounds to heal after your surgery, you should not restrict your diet. Your body needs a balanced nutritional intake, low in cholesterol and salt. Wait till you've been seen at your follow-up appointment before starting a restrictive diet if this is necessary. If you need support with your diet whilst in hospital, the dietitian will be able to offer specialist advice and help. Constipation and nausea. Indigestion and constipation are also common, as your normal functions may slow down during surgery. Some patients do suffer from nausea or an altered sense of taste as a result of the anaesthetic and the drugs. Do inform the staff if you are constipated or nauseated, as it can be treated. Cardiac rehabilitation. During your pre-admission appointment or following your surgery, a nurse will talk to you about cardiac rehabilitation. Cardiac rehabilitation is a recognised national programme aimed at helping people with heart disease. It is important that you understand your condition and its treatment, and how you can return to a healthy, active lifestyle and lower your risk of future heart problems. You will be contacted approximately 6 weeks after your discharge and referred to your local hospital or a local community setting for cardiac rehabilitation meetings. Many patients do find it helpful to meet others who have had surgery and to get advice and support from their local rehabilitation team. Follow-up appointments. You will be given a follow-up appointment to see your consultant approximately 6 weeks